everybody. My name is Natalie Renew, and I'm the Director of Homegrown, and I'm so thrilled to welcome you all to this discussion this afternoon, measuring emergency fund impact during COVID-19. Thank you all so much for joining us, and I want to really appreciate our funders and our provider advisors who are joining us today, along with our amazing presenters who I will introduce in just a second. A couple of housekeeping items. We are recording today's presentation, and all of you have been muted through the system. So I encourage you to please put your questions in the Q&A section so that we can be sure to include those questions. We will have a nice chunk of time today to discuss your questions. So please, consider putting your questions there throughout the conversation. I am really thrilled for the conversation that we're going to have today, and I'd like to introduce our presenters who are joining us today. Firstly, we have Barbara Chow, the Director of the Education Program at Heising-Simons Foundation. Barbara is also a member of Homegrown. We are then joined by Eva Simonson, the Director of Communications, Outreach, and Public Relations at Community Resources for Children in Napa, California, and Jacqueline Wisniewski, who is the owner of Soaring Wings Childcare and Preschool, also in Napa. We are then joined with our colleague Anna Isabel Gabilondo Schultz, the program evaluator at La Red Latina de Educación Temprana, our partner in Minnesota. So we're really thrilled for our conversation today. I'm going to give you kind of a quick overview of our agenda for today's discussion, and then we're going to get started. We'll start out with really a look at the design and kind of the underpinnings of the emergency fund and what we aimed to achieve through this initiative. I will then talk through some of the preliminary data that we've collected from a pretty large provider survey in the emergency fund footprint. We'll then hear from these great panelists and presenters around their experiences in their communities in Minnesota and California, and then talk a little bit about the implications and policy ramifications of the emergency fund work and the impact on home-based providers as a result of COVID-19, and then really spend some time digging into your questions. So again, please use the Q&A section to share your questions with us throughout the discussion so that we can capture those. So with that, I'm really thrilled to turn it over to Barbara Chow to get us started in our discussion. Thank you, Barbara.
Yeah, thank you, Natalie. So I'm just going to start with a little bit of background about Homegrown and kind of why it was created, and then move to just a bit about the emergency fund itself and a toolkit that was formed as part of it. And I'll talk a little bit about why we chose this particular approach. So just starting with Homegrown. So what is Homegrown? Homegrown is a funder collaborative that's really focused on home-based childcare, which includes both family providers and also the informal family, friends, and neighbors sector. It includes 11 foundations. It's hard to read them all at once, but 11 foundations, 7 of whom participated in this COVID emergency response. Next slide. So why was the collaborative formed? It was really formed for a few reasons. Mostly because it's a very huge part, I think, of the early childhood sector that is probably one that has gotten less attention and is less well known. But most kids are actually served in home-based settings. It's the largest portion of the early childhood sector. And this form of childcare disproportionately serves kind of in some ways the highest need areas, children and families from rural areas, those with non-traditional hours, infants and toddlers, children from families of color. It's an incredibly important sector, I think, that again is reasonably less well known. And it's at the same time that it's serving this really critical role, it's the least financially secure part of the childcare sector. And you can sort of see from these statistics the average annual income is for people working these really very, very long days is pretty low, and the average kind of wage is also often below minimum wage minimum wage and often without benefits. Next slide. So it's kind of, that's the broad context of homegrown. And into that context, this emergency fund was launched in April 2020, really quickly after the first shelter-in-place orders were issued. It had really two parts to it. One is a toolkit that provides some amazing information. Take a look at it sometime about how to set up an emergency fund if you're a funder that's trying to do that. And second, it's a pooled fund. It set up a specific pooled fund that the 7 foundations contributed to, that was designed to provide kind of immediate economic relief to home-based providers through a set of regional organizations, as you can see. There were kind of 3 core goals in those early days. The first was just to maintain the supply of home-based childcare. The second, again, kind of remember those first chaotic moments, is trying to provide care for essential workers, health workers, others that really could not work from home, and to sort of stabilize the sector as a whole, which we knew pretty quickly after the first few weeks was going to be facing a lot of distress. Next slide. So, why did we take this particular approach, this emergency approach? There were lots of reasons for it, but I would start by saying that a lot of foundations on that list, including ours, I think often try to put most of our resources really into kind of the long-term structural systemic issues that are causing these inequities in the first place, and probably a little bit less into direct service, quite frankly. So this was a bit of a shift for us. So why did we do it? I think a few reasons. One is that it was really clear from the first few weeks that this situation was wildly different from anything we had encountered. It was very sudden. There was a lot of confusion. As you can sort of see from this data, and I won't read it to you, it was a survey of childcare providers in California from our colleagues at the Center for the Study of Childcare Employment in Berkeley. There has been a very, very significant kind of financial hit to particularly home-based, to the childcare industry more generally, but particularly to home-based childcare providers. One of the kind of statistics that I've really focused on is this 34% who took on credit card debt for program expenses. So, this is a group, I think, of folks who were incredibly dedicated, and are going deep into their own debt, often may not have taken a salary in some time. You may hear more about this later, in order to maintain this really vital service, because I think they recognize that families desperately need it, and they are kind of doing everything literally they possibly can to try to provide it right now. Lastly, I think we had thought back in April that the public sector would eventually step in, but it was not. That was all kind of taking a bit of time to get going. And we've actually since learned that the childcare industry as a whole, and particularly family childcare, have not actually been able to take full advantage of a lot of the federal programs that existed. So next slide. In addition to just the dire needs, I think we took this approach because we wanted to do 2 things at the same time. We wanted to provide support that would kind of address these immediate dire needs, and also to try to do something that elevated the profile of this important sector, raised it with local funders, got some matching going. The 1.2 million was, we were kind of very happy to see, was eventually fully matched by local funders. And so we were trying to take both kind of a systemic approach and also address these immediate needs. The toolkit, which I mentioned before, which Natalie and her amazing staff put together, is a very specific kind of roadmap for putting together your own fund. So if you're still considering doing this, and the needs are still hugely great, so we're hoping if you're a funder out there, whether you're a public sector funder or a private funder, there's again a huge need to do it. This is a bit of a jump start. It gives you templates about surveys that you might ask, sort of a whole very clear kind of how-to about setting these things up. given the experience that we've already had. So I think with that, I'm going to turn it over to, let's see, I think back to Natalie, who's going to provide some information about the data.
Thank you so much, Barbara. Really appreciate that background. So I'm going to take us through some of the preliminary data. I'm going to, if you have not had the opportunity already, we have 3 short papers that are posted on our website and were sent out with the information for the webinar, where there's a greater degree of detail there. But I'm just going to provide some of the highlights of what we learned from our initial review of the data. So as Barbara mentioned, we established the emergency fund with $1.2 million in a pooled fund, and we're able to allocate those funds to 13 regional organizations in 12 states. And I'm not going to read all 13 of our partners, but really we're so grateful to them, and we're grateful to the matching funders in these 13 locations who really came alongside Homegrown to establish these funds on behalf of home-based providers. And as Barbara said at the outset, we had kind of a one-to-one cash match for the $1.2 million. But since the inception of the funds, many of these communities have been able to garner additional financial support for their emergency fund. And at its outset, we anticipated reaching a little over 1,800 providers and caregivers, both licensed family child care providers and licensed exempt or unregulated family, friend, and neighbor providers, together who are serving about 8,100 children and their families. Next slide, please. Alongside sort of the deployment of the funds, we worked really closely with these partner organizations to collect data in the form of a survey. And again, are really grateful to these partner organizations who really did the hard work of not only distributing the funds, but supporting the data collection effort, which we believe has been largely successful. 61% of the family friend, 61% of the licensed family child care providers responded to the survey, and 39% of the family friend and neighbor providers responded. And we collected surveys from 1,250 about providers, which is really a significant amount. And as a result, we've been able to produce these 3 short preliminary data reports. We collected a lot of data that we have not completed analysis of, and we are continuing to collect data from our partner organizations. So we anticipate, being able to issue a final report with additional insights. But this is what we've learned so far. Next slide, please. So firstly, when we kind of look at who the family child care FFN providers participating in the fund are, we found that most of the family child care providers are small home providers who are operating solo. They have no additional staff supporting them in their operations. And then among the family, friend, and neighbor providers, 43% are caring just for their family members, 19% are caring just for friends or neighbors, and 38% are caring for a combination of their families and friends. Next slide. At the onset of COVID, we found that disproportionately compared to other care settings, these home-based providers continue to operate. In our survey, 87% of the family child care providers continue to operate, primarily serving essential workers, and 65% of the family, friend, and neighbor providers continue to operate. From some of our national sort of data sets, including a recent Child Care Aware report, they report that about 79% of family child care providers stayed open, and about 65% of centers. So really saw a greater than the national average continued operations among the recipients of the emergency fund. Next slide, please. We did see that providers lost or had dropped in enrollment. So among family child care providers, there was a drop of 45% of their overall enrollment. And among the family, friend, and neighbor providers, they lost about a third of their enrollment. And this really sort of sets up this really precarious situation for home-based providers where enrollment drops, therefore their revenue and tuition drops. However, costs escalated as they needed to adjust to new health and safety protocols, purchase supplies and cleaning materials that were becoming increasingly expensive. So, really sort of set up this situation where they were earning less, but the cost to continue operating increased and really placed significant strain on home-based providers. Next slide, please. So this slide really takes a look at how providers use the emergency funds, and we kind of compare and contrast here a little bit some of the differing priorities of the family child care and family friend and neighbor providers in terms of how they use the funding. Licensed family child care providers really focused their use of the dollars on cleaning supplies, utilities, housing costs, food, and income replacement. Whereas the family, friend, and neighbor providers really were focused on much more basic needs, food, utilities, cleaning supplies, and housing. And I just, can't really underscore how surprised we were by these data to know that the providers who were really ensuring that our frontline workers can get to their jobs in hospitals and delivery and all the things that we've relied on during the pandemic needed to use this, additional money for such basic needs really was quite remarkable to us. Next slide, please. In our survey, we asked providers to tell us a little bit about what additional supports they may need. And so from our licensed providers, we heard that they needed additional support around both finding and affording cleaning supplies. They really were challenged to get good, timely information, both about health and the status of the pandemic, but also around where resources might be available and how to access resources. Also needed training, help with accessing public funding sources and income replacement. And again, a pretty significant number indicating that they needed additional support with food. Next slide, please. Among our family, friend, and neighbor providers, again, really saw some of these very basic needs. Really, over half of the providers reporting that they needed additional assistance with food, assistance identifying and affording cleaning supplies, a desire for more training, better more information, better information, and some other needs that they identified through the survey. Next slide. In addition to sort of asking what additional supports they needed, we asked providers to tell us a little bit about what their primary concerns are, what they were worrying about as they, as they were experiencing the pandemic. Among the family child care providers, we heard really two big issues through kind of open-ended questions that we have coded and analyzed, which was concern around drops in enrollment and the result on the finances of their small businesses, and then concerns around health, their own health, the health of their families, and the health of the families and children that they serve. And we saw some differentiation in this data around providers who were open and closed. Providers who were open expressed more often concerns around finances, and those that were closed expressed them more often the health concerns. Among the family, friend, and neighbor providers, 39% reported these concerns about health, again, of themselves, of their own families, who live in the place where they serve children, and the children and families that they're serving. Next slide, please. And then lastly, we asked providers, who's helping you and where are you getting support right now? And both the family, friend, and neighbor providers and the licensed family child care providers reported that the emergency fund intermediary organizations, the partners in this effort, were most frequently cited as the supports that providers were leaning on during this time. Licensed providers also reported to us that they were gathering support from their peer providers, and we just heard some incredible stories from across the country of ways that providers have been supporting one another, sharing information, even if that information is, which Costco in town has Clorox wipes today. There's just been this really vibrant peer support network, very informal networks in our communities. Licensed providers also reported gaining support from licensing and subsidy state-associated systems. Among the family, friend, and neighbor providers, many of whom are legally exempt or unregulated based on their state rules, they were really unlikely to have received or less likely to have received supports from state-linked systems. So that is sort of a quick view of the data. Again, we have these 3 short papers, one focused on the family, friend, and neighbor data, one focused on the licensed family child care data, and then a report that looks at these data in comparison, and really encourage you to go to our website and download those. We also have additional information on the website about our partners and the intermediary organizations across the country that supported this work. But now I'm really excited to have our panelists join us and share really what this looked like in the community and, their experiences. So I'm really thrilled to have Eva Simonson joining us to share a little bit of the work that they did in the Napa area around their emergency fund.
Thank you, Natalie. Hi, my name is Eva Simonson, Communications Director with Community Resources for Children in Napa County. First of all, I'd like to thank the funders of the Homegrown Collaborative for making our important work possible, and all the other amazing nonprofits and organizations who were funded. So next slide. We are a small community-based nonprofit serving about 4,000 individuals every year with early learning and care programs. We strengthen basically the adults in a child's life, whether they're parents, caregivers, FFNs, or child care providers. We, like many others, started offering our programs virtually. So we have remote playgroups, story time, and parent cafe. We support FFN informal caregivers with resources, and we also continue to strengthen child care providers with professional development webinars and one-on-one quality coaching. We offer ASQ screenings, and families can pick up take-home activities. We have drive-thrus where they can come and pick up supplies and take-home activities. We also connect families to childcare and help low-income families find and pay for childcare. And during the early days of COVID, we helped 150 essential worker families find and pay for childcare. Next slide, please. Next, to give our work some context, I wanted to share a little bit about our county. We are located just north of San Francisco. And what people don't realize when they hear Napa Valley is that we have a large workforce of hospitality and viticulture workers who are the driving engine of our economy. And many work irregular hours, are Spanish speaking, and low income. So we support many low to medium income families here in our community, and 50% of young children come from Spanish speaking homes. Due to the high cost of living here, the number of children in our community is declining. Our county is the 7th least affordable county in the United States. During normal times, we have about 3,000 licensed childcare slots available, and only enough for 1 in 4 children under 12. So pre-COVID, we already had a childcare deficit. COVID forced the closure of many centers, but most of our family childcare homes stood strong. An estimated 750 slots were lost, mainly at centers. And our schools have been in distance learning like many others since March 13th and are scheduled to go back at the end of October. So this creates some uncertainty for families and providers. It's unknown what's going to happen. And many are asking, when are the children coming back? And the question is not, we can't really easily answer that question yet. In addition, we've had wildfires hit us. I don't know how many of you have heard, but California and especially Napa Valley has been hit really hard this year. And it's becoming an annual event where October is fire season month. And if we're not directly experiencing a fire, we could be experiencing lengthy public safety power shutoffs, which also has a detrimental effect on childcare. So during the wildfires, 2 centers were destroyed and 17 sites had to be evacuated, and they have not yet returned to their sites as the damage is being assessed. Next slide, please. The Emergency Relief Fund has been crucial for us to support and strengthen 52 providers who care for 315 children currently. And $100,000 have been distributed in order for them to stay open. And 96% of the providers who received a grant have stayed open. Funds were used to pay for rent, utilities, cleaning supplies, and food. And 100% of the businesses are women-owned, 50% minority-owned. Additional supports that we have provided during this time include our bilingual webinars on emergency preparedness, which is really important in our area, self-care, trauma-informed care training, and weekly wellness calls to connect childcare providers to resources in our community. And we have distributed $60,000 in PPE and supplies and connected providers affected by the fires to FEMA and other resources. And thanks to the early support from Homegrown in May, we were able to leverage more than $700,000 in local funding since then. Most of this will be distributed in the form of provider grants. And the Homegrown grant came at a time when no one really knew how to go forward. And we were really fortunate to have the community of practice to learn from, among other things, how to structure an emergency fund with transparency and equity, and how to advocate for home-based childcare. So having the structure in place lent us credibility when we approached other funders. And as a result of our advocacy and empowering more than 15 childcare providers to provide public comments at the Board of Supervisors meeting, we secured the maximum allotted funding from the CARES Act for our county for childcare. And we will be starting a second round of provider grants in November. So although on the surface, it looks like we have stabilized childcare in our community, we are still concerned about the future. Next slide, please. Enrollment is down 48%. And families who are fortunate enough to be able to work from home, we're seeing that they're choosing to not send their children back to childcare right now. So we have been able to support childcare providers, and they are not officially closed, but for many of them, enrollment is down 50%, which means their income is half of what it used to be, which is not sustainable. And they are asking us, where are the children? When are they coming back? As our economy rebounds and hospitality and viticulture jobs return, families will need childcare again, but will the providers be there? Many of them cannot live on half their income until families are ready to come back. Many will have to close and look for other work, and possibly will never reopen their childcare businesses again. We can't afford to lose them. We've worked too hard to build a quality childcare infrastructure in our county. However, 47% right now are reporting that they'll have to close within 5 months without further relief. And the relief that we have secured will only go so far. Many have maxed out credit cards. Those who could applied for SBA, PPP, EIDL, and other loans. They're exhausted. They are needing emotional support, and they see no end in sight. What came to light during this time were the inequities in our current systems. Many providers reported that they did not apply for SBA PPP loans. The application process made it very difficult for them, even with supports, even with webinars that we connected them to through Homegrown. The barriers were just too big, among other things, language and technology. There are some positives, however, that have emerged from this. And I'd like to introduce you to a childcare provider in our community who has been an inspiration to us and to her peers. She has weathered the storm and has remained a strong advocate for other childcare providers. It's my pleasure to introduce Jacqueline Wisniewski, owner of Soaring Wings Childcare and Preschool here in Napa. And she'll tell you firsthand about her experience and how she was affected and how the funding has helped her. Thank you.
Thank you, Eva. My name is Jacqueline Wisniewski from Soaring Wings Napa Childcare and Preschool. I am a minority business owner. I opened my childcare in 2014. Soaring Wings is a large family childcare home licensed for 12 to 14 children with 2 assistant teachers. We participate quality counts through community resources of children. I am a family childcare advocate at the state and local level. In August 2020, I delivered comments at Napa County Board of Supervisor meeting to request allocation of funding for family childcare providers. Family childcare providers are essential to our economy. Since shelter in place was implemented in March, we have been open to serve families of essential workers. During those difficult times, our attendance was low. Some parents pulled out their children because they lost their job or were concerned about being infected with the virus. Some parents kept their children at home. We cared for the children of essential worker. The situation was uncertain and stressful. The scarcity of cleaning supplies and PPE contributed to my concerns. We had a hard time finding and keeping PPE and cleaning supplies in stock. If we found it, we had to pay higher than the normal price. We also had to do extra cleanings of toys, equipment, and surfaces to keep everyone healthy and prevent transmission. Community Resources for Children reached out to all family childcare providers who stayed open during the pandemic. They offered us an emergency funding, grants sponsored by homegrown childcare organization. We got funded in July 2020, which helped our childcare stay open. I was able to use the funding for cleaning supplies and PPE, food, and other stuff. I was able to hire another assistant so I can participate and advocate at Napa County Board of Supervisor meetings at the and state level. We are very thankful for the financial support and peace of mind. So far, we haven't closed or taken any vacation. We have not taken any vacation to reduce the chance of being infected. Our current struggle is the need of emotional support and finding time for self-care. Thank you so much.
Thank you so much, Jackie. Thank you for being with us here today. I know you have a home full of young children this afternoon, so we are so appreciative of your willingness to join us today and to share your story. And thank you as well, Eva, for that really great overview of your very impactful emergency fund. Thank you both. I'm now really excited to introduce our colleague in Minnesota, Anna Isabel, who's going to talk a little bit about the emergency fund there that was focused on serving family, friend, and neighbor providers. Anna Isabel, thank you so much for joining us this afternoon.
Thank you, Natalie. I am a program evaluator for La Red Latina Educación Temprana. I met them in 2016 when I was supporting them with evaluation. I also work for the Center for Prevention at Blue Cross Blue Shield of Minnesota, and I'm so excited to be here and tell you about the work of these amazing women. Next slide, please. La Red Latina de Educación Temprana, the Latino Early Child Care Provider Network, is a group of 13 Latina leaders making healthy changes that benefit children and members of the Latino community in the areas of Richfield, Bloomington, and across Minnesota. La Red means the network. It does not mean the color red. And I'll be using just that name for them throughout the the presentation. They were established in 2013. La Red's mission is to provide early childhood trainings, capacity, and leadership development for Latina childcare providers to deliver the highest quality childcare possible. And by doing so, they support the health and well-being of their families and their communities. The leadership of La Red is 100% from the community. They're all FFN childcare providers and Latina women. Their members are also 100% Latino, with about 96% of them being women. And they also have a lot of their members who are undocumented or live in mixed status families. Next, and that's a picture of 6 of our leaders. Next slide. Just a little bit of context of FFN in Minnesota. Nearly 40% of children age 2 and younger and 25% of children age 3 to 5 are estimated to be primarily in FFN care. In Minnesota, FFN lack access to education, resources, funding, and support. Most of the resources are currently aimed at formal and licensed child care centers or at parents. La Red is working to eliminate the systemic barriers that FFN childcare providers face by providing quality trainings in their language at no cost, educational opportunities, and leadership development to their members. Next slide, please. So pre-COVID, as you can see here, the beautiful and colorful pictures on the top, they will have, La Red will have trainings every month where 40 to 50 women will come and get trained on different trainings around CPR, first aid, healthy early childhood development, trauma and healing, development of social and emotional skills. But during COVID, they did a lot of their work by listening to the community and seeing what the community needed. And a lot of what they heard is that the community needed cash assistance, they needed information around COVID, and they also needed a lot of resources, especially around food. So what they are doing now is that they secured funding from Homegrown and the Blue Cross Foundation to provide cash assistance to their members and support a few childcare providers to stay open during the pandemic. They also are distributing food almost bi-weekly since April to thousands of families in the Twin Cities. They collected masks and supported testing drives for the community. And they're also supporting the community on how to do how to use virtual platforms such as Zoom. They share videos on parents how to create routines in their homes or ideas on what to do with their children. Next slide, please. La Red was so excited to have the opportunity to apply and receive for the Homegrown funds. When we received the app, we couldn't even believe it, that this was an opportunity that they could provide to their members, that there were Homegrown's funds were flexible and were providing immediate cash assistance to their members, and an opportunity for La Red to alleviate some of the members' burden was extremely important. And flexible funds are particularly important to La Red because of the population that they work with. Undocumented Minnesotans are one of the most vulnerable populations in the state. They distributed funds to 163 FFN childcare providers at $500 each. To identify the FFN providers, we conducted surveys in Spanish via phone. Understanding their membership, we created a survey training with 8 of the leaders came together. We went through the questions. We changed a little bit of the language of the questions, and then the 8 of them conducted the surveys over the phone. We distributed the funds mostly via gift cards, and about 4 of those were money orders. And in analyzing the data in comparison to the overall FFN, overall to Homegrown's FFN data, the data is similar. The average number of La Red members, they care for 3 children. Over a little half of them remain open after COVID, 55%. The top for the overall Homegrown data, the top who they care for are only for family members, and La Red members, 41% of them care for a mix of family and friends. The next one is the use of funds. The next slide, please. Thank you. So the use of funds is also very similar to the overall data for homegrown, just a little bit different here that 86% said that they'll use the funds for utilities, which includes paying for their phone, paying for light, paying for gas. And also 72% food, 62% housing, and 62% cleaning supplies. The next slide. And an additional support also similar to the overall findings. The top need is food, 55% training, and 54% cleaning supplies. Next slide. Their major concerns is their health, getting COVID and not be able to work, getting COVID from the parents of the children that they care for. Just overall, there was just a lot of fear and not knowing what to do when they get the virus to infect their families and not be able to isolate in the same household. And also reduce work hours. A lot of their parents are not back full time, so they're not able to get full-time work either. A lot of them are unemployed, not able to work. Some of them reported that they got COVID, so they had to close and they haven't been able to get children to care for, and also not being able to pay the rent. Some of them recorded that they haven't been able already to pay the rent for months. Next slide. So finally, we have a video from Julieta Baxin Pucheta, who is one of the leaders of La Red. She currently lives in Minneapolis. She's a passionate, loving, and high qualified childcare provider, and you're gonna hear from her on her experience and really her ask for sustainable support and funding for FFN childcare providers to receive training. Thank you.
Hola, mi nombre es Julieta, soy de Veracruz, México. Tengo alrededor de 10 años cuidando niños en casa y me encanta hacer este trabajo y empecé cuando mi nieta nació hace 10 años atrás porque tiene una deshabilidad no muy grande, pero para mí fue mejor cuidarla en casa. Soy una abuelita, amiga, vecina, que ahora lo hago aquí. Mi casa es un espacio para cuidar niños y tengo una pasión de hacerlo y me encanta, que es lo principal que pienso yo que uno debe de tener. Mucha paciencia. Los obstáculos que ahorita me ha sido difícil fue lo del COVID-19, porque yo tenía a mi cuidado 6 niños, más mis 2 nietos, pero solo quedaron 2 porque pues las papás se quedaron sin trabajo y sigo igual porque a lo mejor algunos tienen miedo de volverlos a traer o salir a la calle, salen a lo mejor lo necesario. Algunos papás se quedaron sin trabajo completo, con medio tiempo, y bueno, pues la ayuda que yo recibí de Home Grow me fue muy valiosa para comprar artículos de limpieza, hacer pagos de unos biles y comprar alimentos. Y es una ayuda que yo agradezco mucho para poder salir adelante. Me gustaría que fuéramos más apoyadas, recibiéramos más apoyo de las familias, amigos y vecinos, porque tomamos más de 80 horas de clases por año, hacemos un buen trabajo. Gracias a la red latina tomamos clases sin costo alguno, y aquí las instituciones gubernamentales no nos apoyan, desafortunadamente, y me gustaría que en un futuro lo hicieran porque damos un trabajo de calidad.
Thank you so much, Anna Isabel. And, you know, we are really indebted to Julieta for sharing her experience with us today via video. Thank you. I'm now gonna ask Barbara to rejoin us and to sort of reflect on some of the implications and maybe policy issues as we move forward.
Thanks, Natalie. Yeah, that was, I don't know, I listen to these stories and I just feel such admiration for the people that are doing this really hard, critical work. And it makes me think, as I imagine many of you, that this is such an important kind of infrastructure. And, you know, I think we've really kind of learned this the hard way, which is when it's gone or when it's failing. And we're in that situation right now. So a few things about the kind of policy implications of what you've heard and what we're learning. One is that we've known for some time that the number of home-based child care providers has been declining. And what we've kind of ironically found most recently, there was a study that Homegrown conducted in partnership with a group called Winnie, which is, I think, an app, in August, that revealed that, in fact, the demand is so much greater now. So while the providers are declining, the demand has increased significantly for lots of reasons that you've, I think, heard of a little bit now, that families may be more comfortable with home-based providers because they're smaller, more intimate settings, centers are larger. And so kind of for those reasons, we've seen an increase from 10 to 13%. Again, kind of lower center-based care. Many families have indicated that it's really it's not simply because centers are closed or because they're nervous about it, but it's actually the preferred form of care. And we've seen increases again in kind of relative care. The Bipartisan Policy Center indicated that. So what does that mean for the public sector? Thanks. For the next slide. A few things, and I saw some chats, some indications around this in the chat as well. Some states have actually taken some proactive action. They've done things mostly broadly for the child care sector, and but they've gone ahead and included home-based child care, which is incredibly important because often, again, it is more forgotten. So, for example, making sure, we've seen huge enrollment declines, but maintaining subsidy payments based upon pre-COVID enrollment is one way of kind of sustaining the sector. Several states have started emergency funds similar to what Homegrown has been doing, and I think they've been using the CARES Act. I think Michigan has done this as a way of providing direct support for providers. They've created other kinds of new initiatives to sort of meet childcare needs, including finding kind of new websites to help locate open childcare providers. So I think states have tried a variety of different things, but truthfully, the early childhood sector is mostly supported by the federal government. 60% of funding is federal. And so I think we're very hopeful that some kind of significant federal funding will eventually kind of make it across the finish line. There was a bill that the House passed actually a while ago and then repassed recently that would have provided an additional $50 billion and then $7 billion on top of that directly to providers to help support this this industry. It would provide increased payments and allow them to serve more families. So that, I think, remains, our greatest hope for longer, kind of for a way out, even though it has not yet happened. The other kind of piece I think that Homegrown has really been supporting is that you can see the importance of these networks. I think just in the voices of the people you heard today, that the home-based childcare sector is one very fragmented and very distributed. And it's really important, I think, to have kind of networks that help bind them together, that help. There's a lot of isolation, I think, within the kind of individual families. And so providing networks that provide both information and support and access information about federal financing, to the extent there is some, are all kind of the critical kind of way out of maybe the path forward. So we put a lot of, we believe a lot in networks, and there are many ways in which public support can expand these networks too. So those are just a couple of very kind of preliminary ideas about what could be done in the future to help support and kind of create a little bit more certainty for this important sector. So
thank you very much, Barbara. Appreciate that. I'm going to ask all of our panelists to come back on video so that we can take a few questions before we close out this discussion. And I encourage all of you that are on the webinar to share your questions in the Q&A section. So we have a first question here from Janet, kind of asking how she can take advantage of an emergency fund. And Janet, you know, one of the things that we didn't talk about, but I will add now, is that, you know, Homegrown was able to support 13 communities in establishing their home-based childcare emergency funds. But we know that there are several other communities around the country that use the toolkit to establish emergency funds. And we're happy to follow up with you or any provider offline to connect you with those funds and you know, community partners around the country if they are operational in your community. So really happy to do that. We have a question from Pam Tatum, who has been a partner with us in this effort, and she sort of asks the $57 billion question, which is that, you know, philanthropy in this case was able to really move quickly and kind of get involved very early on, but there really are limits to philanthropic support, and there's really been significant inaction at the federal level to get the kind of funding we need into our childcare sector. So Pam asks here, you know, pretty desperately, I'd say, where do we go from here? What's next? How do we save the industry? So any of our panelists that would like to kind of add and maybe build a little bit on some of Barbara's reflections, we'd love to hear from any of our panelists that want to take on this question.
Yeah, I think that's the question that we're all asking. But what we found, what we can do is really get all of our ducks in a row, know our current climate, have our data ready so we can speak clearly and make a case to our local officials. We can meet with the community foundation. There are many competing interests right now, and we just have to focus on bringing that childcare piece to the forefront and helping people make the connection between our economic rebound and childcare. So it's really just that. I mean, just continuing to educate about childcare.
Great. Thank you, Eva. We have another question here from Cameron around how states and national partners are supporting providers with meeting the needs of school-age children, recognizing that as a result of school closures, many children may be remote learning in their childcare program. Before I, turn this one over to the panel, I will say, and I'll maybe ask Karen or Sam to drop in the chat. Homegrown has developed a web resource for providers and policymakers, really focused on this particular issue of how home-based providers can support the needs of school-age children who are remote learning, and also really calls out some of our concerns, in particular that this may result in displacing very young learners like infants and toddlers from their childcare spaces. So I wonder, Jackie, if you are still here with us on the call, if this is an issue that you've encountered in terms of supporting school-age kids, and if you would like to offer any insight. I think Jackie may have been whisked off to take care of some programming to take care of some kids in her home. I don't know, Eva or Anna Isabel, it looks like Ruth has joined us. Would either of you like to respond to this question?
So we do have a few childcare providers who are caring for school-age children, and they've had to set up separate areas. They put in plexiglass and made sure that they had the right equipment. But some of the challenges are the children are sent sometimes without the right plug. Their devices run out of juice. They can't continue learning. And just the constant struggle of having to move between different Zooms and the preschoolers and then the infants. It's definitely a struggle. So I really don't know what the solution is. I know a lot of people are talking about it right now, so that's good. And hopefully we will gain some best practices out of all this.
Yeah, I agree. I think it's also just a place to kind of underscore yet another challenge that's been sort of heaped on top of many other challenges, right? So in addition to sort of providers grappling with loss of income and, increased costs, now they are really adapting their learning and business model to meet the needs of, another group of providers. So, I think it's great that home-based providers are stepping up, as we've seen them do throughout the pandemic, but I think it really does pose another challenge for them in order to continue to meet the needs of their communities. So with that, it looks like we don't have any other questions. I really want to just say a huge, huge thank you to Eva and Jackie and Anna Isabel and Barbara for joining our conversation today and for sharing their insights with us. Really appreciate you all taking the time to join us on this call today. We will send a recording of this meeting out to you along with copies of our papers, and really encourage you to be in touch with us and to share with us what you're doing and what you're learning in your communities and the ways that Homegrown can be supportive of all of you. So thank you all so much for joining us today. We really appreciate it and wish you all the best.